You know, uh, Thank you for the opportunity to be here, and also congratulations to all of you. For this Asian Pacific Islander Heritage Month. I think we have made tremendous progress over the years. I think one of the fundamental thing is our belief in like a democracy, freedom, and to take this new line and contribute to this new line. So what I would like to do is just tell you what we are doing. Our research team related to Asian Pacific Islanders' health. So particularly, I think there's no better disease. I won't say better. There's no other disease can compare with viral hepatitis and the liver cancer in terms of its effect, its impact on Asian in general. All right, so that's why I just give you some brief introduction on this, on viral hepatitis as well as liver cancer, and lastly, just tell you what we are working on and trying to really make impact on this disease. So you can clearly see, the two hepatitis, as from your medical school class. So we have worldwide we have 350 million people infected by hepatitis B. That's alone. I don't have space, all the numbers from each country. Just give you one example. And in China alone, we have there are 120 million people carry hepatitis B at the moment. So it's really a serious disease. And hepatitis C, worldwide again is 170 million people. I think particularly in Asian country, Japan. In Japan, for example, their predominant hepatitis is actually hepatitis C. So how about in the United States? And you can see here is majority of the hepatitis, as you know, is still hepatitis. If you look at the viral hepatitis, it's still hepatitis A. However, nobody really makes big deal on hepatitis A. It's because it's a self-limiting disease in the vast majority of patients. But remember, people do die from hepatitis A because of permanent hepatic failure. Because this disease tend to be very violent, all asymptomatic depending, they have the whole spectrum. However, it's most of the, say 99% of patients recover from hepatitis A without no consequence. However, hepatitis B, hepatitis C is a different story. So you can have self-limiting phase, but most of patients will develop chronicity after acute phase. So you can see even in the United States, hepatitis B is still significant problem. Although we already have vaccination, I will talk about it in the next few minutes. And however, hepatitis C is a more problem. As basically 80% of patients exposed to hepatitis C will develop chronic infection. But the good news is hepatitis C now it can be cured with a big price tag, and I will talk about it in the next minute. So the disease is just pathologists will have to show you some slides, some of the tissue, what it looks like, right? And you can see this normal liver, and you have acute hepatitis, on the upper right corner, and then you develop chronic hepatitis. So chronic hepatitis itself is not a really big problem. The problem is you have chronic hepatitis and then you become cirrhotic liver. See, it's on the right lower hand. You can see the cirrhotic nodule, and on that, when people with cirrhosis, so they will have higher risk for liver cancer, which is fatal by itself. And cirrhosis by itself is also can create significant mortality. So then the other thing is it's the cancer. That's the part of in the world, for example, new liver cancer cases is around it's about around 1.5 million people worldwide will get liver cancer every year. All right, I mean the primary liver cancer, not the metastatic colon cancer. So that's another thing is in most of the cases are from Asia. All right, China particularly. So every year in China alone is about almost 600,000 people will have a new diagnosis of liver cancer every year. So this is a really significant problem. You see the etiology for liver cancer in contrast to other type of cancer. For example, you really don't know what causes breast cancer, prostate cancer, but however, for liver cancer, in many cases, you know what causes. It's hepatitis B, contribute the majority of etiology, hepatitis C, and others, for example, alcohol. Right now in the Western country is about the fatty liver disease because the population overweight, obese. So for hepatitis B, it's still uncontrollable. In terms of treatment, there's no option. So the reason for that is I won't get into detail. I think for every medical professional, you need to know hepatitis B has a very, very unique replication cycle, which distinguishes this virus different from any virus causing human disease. So I have to say this figure is always I feel proud of it because of my PhD mentor Bill Mason actually discovered this hepatitis B's replication cycle. And also my really other mentor is Dr. Blomberg discovered the hepatitis B virus and designed a hepatitis B vaccine. He got a Nobel Prize for this discovery. So this is just to tell you, his this disease is a very unique life cycle. Every people should know that. So that's also you understand why it's very difficult to control hepatitis B. So this B vaccine, as you can see, the discovery of the virus is back to 1967. So this is Barry Blomberg, and who I worked during my PhD period at Penn, and so and then the vaccine was developed at Fox Chase, Cancer Center, and then in 1976, licensed to Merck and developed the first generation hepatitis B. And you should see it's really using centrifuge to centrifuge a patient's blood for 3 days. I think the young people probably don't know the ultracentrifuge anymore. You have a centrifuge farm, which is about almost 20 ultracentrifuges in one room, and you spin down the patient's blood and to purify the Australia antigen. You probably heard the name, and use that as a vaccine. That's the first generation. Of course, later on will be, the Chiron Corporation developed the recombinant HPV vaccine using the gene engineering approach, express the virus antigen in yeast. That's what we are using right now. As you know, there is universal vaccination back to 1991, and it's right now for every healthcare workers. I think we are obligated. It's mandatory for all of the healthcare workers to get hepatitis B vaccine. It's really effective, and it's significantly changed the dynamic about this disease. So hepatitis C is different. So this is a different virus. Although we named them all different, kind of sounds like they are in the same family. They are not. The hepatitis C is an RNA virus. It's a very different virus. So this is a viral genome. So because of this difference, so we can actually design the specific drug to treat the hepatitis C. So this is a kind of a more, a clear, definite, like a diagram to show the virus itself. And then again, so this one is really causing a lot of problem because the reason is up to 1992, we did not really screen the blood bank with the hepatitis C virus because we did not know. So the virus was discovered in 1989. And then in 1992, we implemented the mandatory screening for the blood bank. So you still have a lot of Americans, or a lot of people walking with hepatitis C without knowing it because they received the blood transfusion before 1992. It takes about 30 years to get this virus to really causing disease in the liver. That's unfortunate. So, and then the first time therapy is use interference treatment. The effectiveness is only it's less than 40%. And until this is a really I was in milestone back to 2014, the first phase trial, with the interferon-free drug, this direct virus therapy, direct antiviral therapy was approved, and since then, 2015, right now, Havani, you probably Havani, the new drug for hepatitis C, it only costs you that much each pill. I mean, each pill is close to $1,000. All right, so this is it's very expensive. We're talking about social, economic, but now I think the price is getting down because the Gilead, company licensing this drug. Actually, the drug was discovered by a very small company based in Princeton. Like in Princeton area, it was a farmer side small company, and they made this drug, and which nobody thought it would be effective. They did this trial, and it was effective. Gilead bought that company with $11 billion. And then that company only had, that time, 40 people. You guys, all of them, multimillionaire. All right. So what I'm saying, I'm not talking about this, but it's remarkable progress. I think we should feel proud of, because New Jersey actually contributed to the really medical revolution in terms of hepatitis C. So for hepatitis, I'm coming to the end. Hepatitis, however, liver cancer has no real. It's not as luck. It doesn't have this luck, because we still have no effective treatment for this disease. Okay, so that's just to tell you that it's very, very problematic. So this is the last slide. Just tell you what we are doing in my research team, in my laboratory. So we're basically working on the immunotherapy and to combat, liver cancer. So one approach, we use is a vaccine approach, and we identify liver cancer specific vaccine, and then the other we engineer T cells. So in our lab, we already produce the CAR T cells for liver cancer therapy. So we pretty much bring this new CAR T ready for clinical trials. I think hopefully we will make some, progress toward to treating hepatitis cause the liver cancer. So I will stop here. Thank you.